Hi, thank you so much for taking time to meet with me today. I know that your loved one has experienced a traumatic brain injury. So, my goal today is to go over what a traumatic brain injury is, explain what your loved one may be going through and what to expect, and how the therapy team will partner with you as we go on this journey together. So, first, what is a traumatic brain injury? Well, a traumatic brain injury, we can think of the brain as a computer with all these important cables and cords that are connected. And so a if those cables and cords get frayed or disconnected, the computer is functioning, but then it can't communicate the way that it needs to. So when a head injury occurs, the brain is shaken or bruised inside the skull. So, like that computer, the connections or pathways have been disrupted. So, kind of the things that we will to expect now that your loved one has experienced a traumatic brain injury is there may be some changes in cognitive communication. So, your loved one may have trouble focusing in a noisy room, keeping track of time, or remembering a conversation that they had recently had. Their language could also be impacted, so they may know what they want to say but have trouble finding the word to say it, or they may take things very literally or miss jokes or sarcasm. Um, Something else that may be impacted is behavior. So this can be difficult for families, but our brains act as the filter for our impulses, and if this is disconnected, then the filter can't work properly. So your loved one may say things that they don't mean, or get angry quickly, or seem emotionless. So next, I want to talk about the role as a speech language pathologist. So some of the things that we'll do with your loved one is we can look at restorative therapy, which these are exercises designed to help retrain the brain and strengthen the damaged connections through repetitive and functional tasks. There's also compensatory strategies. So if a pathway or a connection in the computer hasn't fully healed, we can teach your loved one and you to how to use external aids like memory books or smartphone alerts or visual checklists in order to help restore their independence. So, when transitioning to the home, the best thing that we can do is help manage the environment because a brain that's healing can get overwhelmed by a lot of sensory input. So, one of the things we can do is create a predictable daily routine and a predictable environment in order to help reduce anxiety or behavioral outbursts. So, and then another thing that we can do is we can give your loved one extra time to respond. So maybe an extra 10 seconds or so in order to process what you asked them before repeating the question. So, one of the goals of therapy that we can start looking at now is creating a routine for your loved one, um, because I know that they had a pretty strict routine and schedule, and we want to make sure that they can continue their daily schedule. So the first thing that we'll look at is creating a calendar either on their phone with reminders, or we can create a visual schedule or do both for the home so that they have something to reference for the next step, such as feeding the dog, let's water the plants, and then just for them to help with their daily activities. Um, So again, I just wanted to thank you so much for meeting with me. And um, I wanted to thank you again for meeting with me today. And if you have any questions, feel free to ask me. And we are going to work through this together